Naidu. I am the chair of the Next Einstein Forum community of scientists, and I'm a professor at the University of Pretoria, South Africa. It is my pleasure to also host you today. A little bit about the background for this session. Leaders at all levels are expected to provide guidance on crises, such as the COVID-19 pandemic, where lives and livelihoods of their constituents are threatened. Coordination between the different levels of interventions provide opportunities for a coherent strategy to the management of such pandemics. Early interventions by governments, regional and global institutions highly influences how communities are affected by COVID-19. A clear understanding of a pandemic is needed to determine its origin, causes, and ways of transmission. And this is key for leaders to better manage and reduce its impact on people's lives and livelihoods. So this afternoon, this panel provides a platform for leaders to share their best experiences, specific practices and lessons that have been learned during managing COVID-19 within their own contexts. So we hope to also identify some gaps in the management of this pandemic and propose some deliberate actions to manage future pandemics, especially in Africa. So this afternoon, we are privileged to have an esteemed panel of leaders in different areas. So Professor Mama Fupuanine is the Chief Academic Officer of the AIMS Global Network and President of AIMS Cameroon. Welcome.
Thank you very much.
We have Ms. Aurelia Calabro, and she is a representative and director of the Regional Office, United Nations Industrial Development Organization. Welcome, Aurelia.
Good afternoon, everybody.
We also have Ms. Olivia Bryan-Zank, and she is the CEO and founder of Benefactors Limited. Benefactors is a Rwandan fintech offering tailored working capital solutions to SMEs. Welcome, Olivia.
Pleasure to be here.
We have one more panel member that we do hope will be joining us a little later, and that is Oliver Chunganya, and he is currently the director of the African Center for Statistics at the United Nations Economic Commission for Africa. So, panelists, to begin with, I'd like to ask a question about the importance of information. And I think it's critical for leaders to make informed decisions during this pandemic. So I'm going to direct this question now over to Professor Mama Fupuanine. In terms of the academic year, how has that been impacted? Mama, are you still with us?
Yes, I'm with you. There was a slight interruption. Can you ask the question again, please?
Sure. So my question relates to the importance of having information at our fingertips, especially with people in leadership positions. That's quite key to making informed decisions. And I want to ask that from your perspective as a leader within a big organization like AIMS, and specifically from an academic standpoint, how did COVID-19 impact the academic year, and how was that information that was available to you empowered you to make some informed decisions?
Thank you very much, Sanushka, and I'm really glad to be here and to share with you some of the experience on managing COVID at AIMS. So I think to make, for you to understand clearly how the COVID impacted AIMS, I would like to summarize our pedagogic model in the following terms. Best students from Africa access innovative education in mathematical sciences in a 24/7 residential enabling learning environment taught by top scientists from all over the world, including Nobel laureate, field medalists, and with the support of tutors. You see how our pedagogic model is fully embedded in our lecturers coming from all over the world. Minimum 70% are from abroad. It means that in a center like Cameroon, about 70% of lecturers are coming from abroad. Due to COVID-19, they could not travel, and also the supervision of the research of our students is done by lecturers who are not always in the country or in the city where AIMS is installed. So the lockdown was in mid-March. Unfortunately, we were having 2 courses to complete the review phase, and we were able to move from face-to-face teaching concept to online concept. It was not very difficult, not very easy, but the pedagogical model of AIMS really helped in many ways. The first is that we are in a 24/7 enabling learning environment. It means we are fully equipped with computers, internet, and then in our pedagogic model, one student, one computer, and they are fully trained in the use of ICT for education in scientific computing, and part of the research phase was already supervised by lecturers who are abroad. Therefore, shifting from face-to-face lectures to online lectures in a 24/7 learning environment with students who are well trained, who master very well the use of ICT for education was not very, very difficult for us. And however, I would admit that you cannot move 100% without losing some of the important feature of our academic pedagogic model. Interaction is a key. You see, when we welcome a top lecturer like field medalist Dick Villani, who used to come, he lived in the campus, work with students, eat with the students. And this face-to-face interaction has a strong impact on students, and with online lectures, you cannot have it. And also, how to use technology to really bring students to interact with the lecturer is still not 100% mastered. So moving from face-to-face to online, we did it successfully. We were able to complete the school year, but still we have lost, by so doing, some important feature of our pedagogy model. And this is really the challenge to what to do to maintain standards when a course is taught online, to maintain standards and to maintain quality and to maintain full interaction. This is a question I think I will elaborate maybe later. Thank you.
Thank you very much, Mama. I can also concur that back home at our university, University of Pretoria, we've also used a hybrid approach combining online and face-to-face instruction and assessment wherever possible. And it has its pros and cons, but we've also managed in most cases to finish the academic year. We're still, as we speak, completing the year, and there's many lessons to be learned from that. So I'd like to take up the discussion a little bit later with you to expand on that. But I want to move over now to Olivia. And Olivia, if you can just tell us a little bit about this this concept of just knowing, having the information about the pandemic itself, knowing the risks, and really knowing the needs, because I understand that benefactors is really there for helping with SMEs, specifically during these challenging times. So if you can tell us a little bit more about benefactors and really what you've learned from this experience so far.
Sure, thank you. Well, Benefactors is as you mentioned up top, it's a fintech company. We provide working capital for SMEs here in Rwanda. Specifically, we provide factoring services, which is advances on invoices that are pending. So it's a hybrid between an investment and a loan in a small company, if you will. That also means that our risk profiles land somewhere in between, as though we were a shareholder and as though we were like a creditor to our clients. Obviously, when the pandemic started, there was no playbook for us to go by, and how do you manage this kind of portfolio and this kind of risk profile during a pandemic? So the main thing we could do was just keep an eye out for developments in the market, keeping very close contact with all of our clients. We're lucky in the sense that we've invested heavily in the relationships with our clients, so that when it comes to shocks like this, we've really benefited from intimately knowing our customers, knowing the pre-existing challenges, the opportunities, and the understanding sort of the different sectors that they operate in. Obviously, it depends massively on the sector. We saw that our clients that were operating in tourism and hospitality sectors were severely impacted, where some of our other clients that are, for instance, in the healthcare sector actually benefited and saw increased turnover and increased demand for their services. And we're actually struggling more with delivering on time and having disrupted supply chains, but still very much having a market to service. So there are no rules sort of to go by. There's no playbook. So we really had to make it up as we go along. We changed course a number of times. Had to be very flexible as we were going along. Obviously, in hindsight, we can see some mistakes that were made, but when it's such a fast-moving context, there's very little you can do apart from just dealing with the issues as they arise on a day-to-day basis.
Thanks, Olivia. The message I'm hearing here is about the flexibility and being able to tailor what you are providing to the specific needs of your client. And do you have any case study that you'd like to share with us of a specific client that it really has benefited a lot from this intervention?
Sure. So a number of clients that we work with are supplying the insurance companies here in Rwanda, and specifically supplying them within the healthcare sector. So we work with a number of pharmacies and clinics, health posts, and so on. And they obviously saw increased demand for their services. They also saw the cost of their inputs going up. So we had to be very flexible in that sense. The instinctive reaction as a financier when an economy goes into a shock like this is to restrict new financing. But for those clients, it was absolutely paramount that we were able to continue working with them, and we continue to be able to supply to provide our services so they can continue supplying the healthcare sector. This was also an area where we saw the delivery times were very, very short. Orders would go out within, 48-hour turnaround time. The various procuring entities would to have the financing, have the supplies available, which also means that the financing has to come very, very quickly. And that's one of the benefits that we've been able to give to our clients, is that for existing clients that we work with, we have a one-day turnaround time, which obviously in this kind of situation became an absolute lifeline to be able to continue operating and to meet the demands of their clients and their business partners in a rapidly changing environment like this.
Thanks, Olivia. I want to continue on that. Just to think a little bit, and I'm going to pose this question to Aurelia now, about previous crises. So, in your experience, what previous crises have we experienced in Africa that has really equipped your organization to address the challenges posed by COVID-19?
Yes, COVID-19, in my opinion, is a very specific experience, also because it's a pandemic. It's also something that I think everywhere has been in general underestimated. And so we had to find then specific solutions for and how to respond to this pandemic. Yes, UNIDO, as many of you know, is dealing with industrial development, but industrial development has also to deal with the crisis, conflict, reconstruction, post-conflict, recovery, and so on and so forth. And so in our past experience, I think in Africa particularly, and it was specific to Africa, there is the case of Ebola. For example, in West Africa, we had a project in Liberia that was one of the countries that was most hit by this disease. And what we found very interesting is that we had a project assisting in the post-recovery of particularly targeting women and youth in capacity building, in startup, in helping them to create their own jobs through TVET school in different fields. And what I think it's very important also in the case of COVID, and then I will talk a little bit more specifically about what we're doing for COVID-19, is that we have a partner with private sector, with companies also from abroad, from FDIs. In the particular case of Liberia was with a Japanese company that is called Komatsu. And we have of course, you do all the socio-economic impact assessment and so on. That is very important in this first phase of the immediate emergency. And we helped our sister agency like WHO, that is, in this case, the first organization that is hit by the disease and fully operational in setting up hospital, utilizing equipment that we were producing with the assistance of Komatsu. So this is, I think, one of the things that we can do in these specific cases of natural disaster, but diseases that are coming so suddenly. Of course, the problem of COVID has found us a bit unprepared, but immediately after the first moment that you get a little bit shock and you start to see also developed countries, you see, I happen to be Italian, so my country has been one of the countries that has been in Europe most hit by the pandemic. We put up a sort of approach to be utilized in different parts of the world. We call it a three-pronged approach. We call it prepare, respond, and recover. So depending on the phases of the pandemic. and where the status is, where practically in each of the phases we try to address some step of the disease. For example, in the preparation part, that is the prepare part, we are doing a lot of analytical work and mapping to see what can be done in a specific country, particularly in policy-related policy, in order to stabilize the economy, because we should not forget that COVID-19 affected countries, particularly in sub-Saharan Africa, the specificity lies in, I think, the dependence of three major areas. The first one is the export of raw materials and imports of supplies and consumer goods. Don't forget that a lot of this country depend very much on the exports of commodities, but at the same time they need to import certain supplies that are important to produce a certain kind of equipment, certain kind of PPEs and so on, so that they are not there. So this is the first area. The second area is related to the foreign direct investment, and also the aid that each country is receiving. And then I think you see a third area that is going to be affected are the households from informal activities and remittance, because we should not forget that the large part of industries or SMEs that you find in sub-Saharan Africa are particularly found in the informal sector, where the largest share of the informal sector is covered mainly by women. So women and young people, but particularly women, have been, in our analysis, the ones who have been mostly affected from this specific pandemic. And so we have seen that COVID-19 containment may cause that, has caused that many informal businesses and small companies have dropped out from productions. They are facing bankruptcies. And also the households are also facing a decrease in income, and so most of the countries have faced impoverishment, you see. And so then we will discuss a little bit later about ways on how we could really take some important policy actions that in some countries have been taken in order to face these kind of problems. I think that this can be then discussed later in the next questions, I think.
Thank you very much.
You're welcome.
Aurelia, so some interesting points that you made there, and I'm gonna come back to that discussion about specific interventions that were made. I want to go back to the discussion that we were having with Mama, and that is basically about education and how education was impacted and the practices that have now been implemented at AIMS. I want to ask specifically if there are some gaps that have been identified, and what, in your opinion, are some interventions that need to happen to really empower educators, and let's think about it as a places of higher learning. What should happen, in your opinion, Mama?
Thank you very much, Sanushka, for this question. I would say that COVID forced us to shift a little bit our pedagogical model to adapt to the situation. For example, inviting 70% of lecturers, this represents more or less 20 lecturers from abroad who can no longer come or who cannot come for a long time, has been a challenge. Therefore, moving from face-to-face model to blended learning model has pro and cons, as you said. The gaps we have identified either at AIMS or in the management of COVID-19 in primary, secondary, and higher education in Cameroon are many. Let's start with AIMS, which is more easy to manage, I would say. One is that we would need to increase internet capacity, because when you are going to organize 3 parallel sessions, 3 online courses as parallel session, because during the second phase of our model, what we call review phase, students select 2 courses out of 3 or 4, which means that we are going to organize 4 parallel classes using internet with students connected on their laptop. This is requesting more internet and need quality internet. So one of the gap is internet capacity because of duplicating the online courses. The second is about need to reinforce computer equipment. Some of the computers might be 4 to 5 years old. They might not respond as we would need to really follow the pace. The same applies for the server.
Mama? All right. Sorry, we lost connection there. Sorry about that. Let's continue, and I think the discussion now will just focus a little bit on the last points that I heard other speakers talk about, and that was specifically about the informal sector. And here in South Africa, there has been some government interventions that have looked specifically at the informal sector, and this is where setting up some partnerships with industry. I wonder, Olivia, if you can comment a little bit about impact on the informal sector and any experience you have there and some lessons that you've learned.
Sure. Thank you for that question. I mean, I think there's no doubt that the real tragedy has been amongst the people who are active in the informal sector, and that's really where we see the hardest impact, and also the regression of living standards and gains made over the last decades. And then there's no doubt that sort of as a collective whole, we have a lot of work to do to undo that damage again and get people back on their feet compared to where they were pre the pandemic. So, I mean, our clients specifically tend to be on the bridge between informal and formal sector. They are registered companies and for some part pay taxes, but they still have a lot of traits of informality. And that specifically comes into play when you look at the impact of such shocks as the pandemic. They're not very resilient, and we see across the board very low preparedness for any adverse events, very low cash buffers, and so on. So there's going to be a lot of work ahead of us of rebuilding these companies. We've seen a lot of companies go out of business, or have completed, depleted entirely their capital stock, which means that there's very little on which to start with again. So in the coming years, we'll have to focus on starting businesses again, on providing the startup capital and providing the resources, otherwise skills training that's going to be necessary for companies to start over again. And there's no doubt that we have an urgent task ahead of us on this, but at least it's easier to rebuilding than building from scratch. So there's also hope to be optimistic.
Thanks, Olivia. And I can imagine that those companies that do survive provide some traction for the building of new companies, and it's important to keep those companies surviving. So please keep on with the good work that Benefactors is doing. I want to continue on this theme and just talk to Aurelia as well. And Aurelia, you alluded to that earlier, and you spoke about women being impacted in the informal sector. Do you want to expand a little bit on that and tell us about some specific interventions that may need to happen there? If there are any case studies that you know of, if you could share that with us.
Yes, we are, of course, we are not UN Women. We are UNIDO, dealing with industrial development. So we have, however, done studies that are impacting some of the sectors on a sectoral level, on value chain level. And for example, you see one of the sectors, I'm talking in this specific case of Ethiopia. I take for an example Ethiopia. What we have done, one of the key sectors in Ethiopia has been the textile sector. Is a big textile hub, but also the leather sector. And so what we have done is to conduct a proper gender analysis to see what have been the impact of COVID specifically on these two major sectors. And of course, the impact, most of these, particularly the most affected has been the leather sector. And what we have done, we have been working with a cluster of companies coming from the informal sector, about 170 companies for about 3,800 people. So it is not a small cluster. Out of that, at least 65% are women. So it is quite interesting. What we have done is to develop products that can repurpose, let's say, the production of what they are doing. For example, masks, face masks, with basis in textile, so that they can support also the people dealing with textile, and maybe make the cover in leather, so that they can also have some small inputs, produce special boots for the workers of hospitals and other similar things. So there have been a specific program also done in order to repurposing SMEs and giving a special attention on ladies. But we have worked also with the Ministry of Trade and Industry in order to take some measures. That's what Olivia was mentioning before, in order to stabilize the economy, provide small microcredit, access. These are the things that are missing now. Liquidity for private banks to enable them to provide debt relief. And also, small loans, because the problem of SMEs is that if you go to a bank, to the central bank or so on, they don't give you very small, liquidity in order to keep your company going. And so this has been something that we have been working with the Ministry of Trade and Industry of Ethiopia, for example, but also we did in Rwanda, in Uganda, in Madagascar, that are the countries that are covered from this regional office where I am the director, but also colleagues in other countries and have been doing the same. That is part of this response that UNIDO is trying to provide to countries. Another area has been also improving the ease of doing business in time of social distancing. I think what Professor before was mentioning, before he was cut off, is the importance of promoting digitalization, to improve internet connections, but also doing smart working and also smart business, so production through and selling through platforms. I think this could be a very important way also of online, networking, and also this would help even small companies, small SMEs to get in the informal sector, the necessity of grouping themselves in cluster and working together. So this could be part of the solution that we are proposing in our work, and with specific emphasis on women and also youth, because the population of Africa is composed of young people, you see. That's maybe also because COVID is not so spread in our countries here in this continent, but also because young people is really the richness, and I think we need to invest on them also in thinking in the post-COVID era that hopefully is going to come soon.
Thank you, Aurelia. Yes. These are really important points and key demographics that we need to target. So welcome, Oliver. We are happy to have you.
Thank you. Professor Naido, how are you?
Well, thank you. We wanted to ask you a question at the outset, which was about the Africa UN Knowledge Hub for COVID-19. And just to give us some idea of how important it was that leaders have this kind of information hub to be able to make informed decisions. So from your perspective, if you can share with us what your experience has been, specifically around information and having high quality information at your fingertips.
Thank you very much. I'll probably broaden my response just beyond just the knowledge hub that we prepared. But let me just perhaps give you a little bit of background on the knowledge hub. Now, the knowledge hub, as you know, this is a hub that was prepared out of a request and a recognition that was noticed at country level that they wanted information that is much more coherent, both in the UN as well as countries themselves and partners that needed the information. So we, as part of the UN, we decided we're going to prepare this knowledge hub on COVID to provide information which is curated from different platforms. And that this information must be readily available when one ever wants to use it, but also it should be information of quality and will not allow information that sort of goes out to distort or provide, misinformation, so to speak. So it's a platform that collects information from different sources, puts them in one place, and looks also at the updates on the COVID as it happens in the countries. And countries also are able to go into the platform to look at the solutions. If, for instance, they have an issue that they would like to inquire, they would actually put information or inquire through the platform to get their information. So this has been very, very critical for use in the UN itself, the development partners, as well as at country level. It's been very, very important. Now, one other aspect that is what we found learning through this process is what we saw in the national statistical offices across the continent. COVID has shown the vulnerability of our national statistical systems. When the countries began to put in place measures to manage and contain the COVID situation, it also meant that national statistical offices in a number of countries, they actually stopped the operations. Why? It's because the systems are not modernized. Most of the activities have to be done in person, physically. You have to go and collect the data, see the person that you're collecting the data from. When you're running surveys, if it's data for the consumer price index where you have to go to the market to measure inflation, you have to go to the market and purchase. But this time around, there was no one at the market to collect the information from. And also, even the person who was collecting information was also scared to go out and collect the information because for fear of being infected by the COVID. So we have learned out of that our national statistical systems need to change. They need to be modernized by digitizing basically transforming them all together. So we are now in the process of developing a strategy to transform the national statistical offices to see how best they can actually collect information without having to physically go to a place. Another example I could tell you about is on the civil registration and vital statistics. What we also saw this time around, that when women were most of them were giving birth at home, and they could not even go out and register their babies because of, one, for fear that they would be able to be infected, but also the facilities were closed. So we actually see a situation that perhaps 2020 is the year where we're going to have very poor numbers because we have not been able to collect information the way we are supposed to collect them. We need to find a way of improving the systems by modernizing them so that we can use other methods of collecting data without necessarily having to physically visit the places where you collect data. So this is not going to be easy because most of our national statistical offices, the civil registration systems, the whole statistical systems, they have very weak infrastructure. The ICT infrastructure is not in good place. We need to revamp the ICT infrastructure. People must be skilled with the necessary capacity for them to be able to use the modern technologies and so forth. I think there's also a need to begin to tap on the potential of big data, which has been ignored, and other traditional sources of collecting data. So we have a mammoth task, I think, on the continent to really change the way we do business by changing the processes, using modern technology, but also identifying new partners. For instance, working with the academia so that we can embrace them to help us develop certain methodologies that can be used to undertake some of the statistical processes. Perhaps working with the civil society, NGOs, and so forth, looking for new partners, really trusted partners that would be able to support the statistical systems on the continent. So I would leave it there for now, but if you have any additional questions, I'll be very happy to respond. Thank you.
Oliver, thank you for that. I think I can just ask you a quick follow-up questions because we only have 15 more minutes on this panel session. The follow-up here is what you alluded to was about partnerships. And I know that you are a firm believer in partnerships and the effectiveness of partnerships and coordination at local and international levels. So if you can just give us an idea of how, if one would go about really improving something like the ICT infrastructure in let's start first at the local level and expand there on the continent.
One way of expanding the ICT at local level, at the regional level, is first of all identifying which agencies are in the private sector that have the capacity to improve ICT. So working with the private sector is really very, very important. But of course, it means also having the enabling environment. Here, meaning having the right regulations that allows for what I would call data governance, that the private sector would be able to engage with those that deal with official statistics. Oftentimes, there's concern that when the private sector comes in, they'll probably misuse the data and so forth. But if you have the right governance arrangement, the right frameworks, regulation, and so forth, I think that is possible. So I think engaging the private sector, they have the capacity, they have the means, they have the resources. I think they have to be brought in really and begin to be major players in the data production and not just leaving to the official statisticians, so to speak.
Thank you. That's a powerful message for us. I'm going to invite our audience to please go ahead and ask some questions. You can type your questions into the chat. And while you're doing that, I'm going to ask any of our other speakers, if you would like us to circle back to any of the points that you'd like to expand on, please go ahead. So if any of our panelists would like to...
Yeah. Yes, I would
go
like,
ahead.
if I may, I may add something that more or less Oliver has been more or less in line with what I was mentioning before about solution on improving easy doing business in this time, digitalization. I think that what we should also advise, and that has been quite successful, that we need to go also beyond the short-term agenda for solving business debt crunch, let's say. And we need also to look in ways to make this COVID an opportunities also to diversify and reorient the product mix, and also a way in SMEs and in the industry, and also introduce new technologies and innovations. I think that is a way also to diversify the economy. Also what I think that is very important for sub-Saharan Africa is to take advantage of important efforts also promoted by the Africa Union, that is particularly the African Continental Free Trade Area. And also, I think these will open ways also to solutions that are specific to the to sub-Saharan and to African continent. And I think that there are all the ingredients that also African countries can find their own solution, even to a pandemic like COVID-19, by utilizing this important platform, by working through regional economic commissions and so on, to promote solutions that are, regional, and that also promote regional integration. I think this is a way where different innovation and technology, this is a unique opportunity for a solution that is really tailor-made to the African continent. This is my sort of addition and complementarity to what Oliver has already mentioned. Over to you.
Thank you.
Prof. Naido, I'm back.
Go ahead, Mama.
Okay, so thank you. I was mentioning the gap at AIMS, rather in terms of need to reinforce internet capacity, ICT equipment, and then capacity building for the staff and some of the lecturers for the production and delivery of content. This is very important as AIMS want to expand to 3 new centers during the coming 5 years, and to start also with satellite campuses. We will also have to agree on some standards for our own online courses. You know, online course in a country where internet is stable, electricity is stable, cannot be the same as online courses in a country where there will be internet interruption, as it was the case for me 5 minutes ago, or electricity interruption. So we need to domesticate, as we say. We need to put it to address our local challenges. Now, let us speak about the management of COVID by state and private university out of Ames here in Cameroon. Basically, I would say that in the beginning it was a disaster because, as you know, the large number, providing education to the large number of students is very difficult. When you have a classroom at the university with 1,500 students, you cannot just move this classroom from face to face to online. It's just impossible. So basically, in secondary education, they took time, 1, 2, 3 months before starting with classes on the TV. It means that a lecturer will come and try to reproduce the classroom in the TV room and for the student to attend. One, they could not do it for all the classes. Two, interaction was with only 10 or 20 students instead of 2 millions. And then for higher education, basically what they call e-learning for the COVID period was to put at the disposal of the student document. They had places where lecturers could come and put their courses, and then students could download them and read and maybe ask a couple of questions using WhatsApp or some still platform. So I want to finish by saying that African government really need to invest in education. They have to not just put education as priority, invest in education. It means having appropriate classroom, equipped secondary school, primary school, higher universities, and also invest in building the capacity of students and lecturers in the use of ICT for education, in addition to providing quality internet for all the students. This has been a big gap I've seen, and they were just unable really to do anything that to suspend the class and wait for the COVID to calm down so that they could resume the classes to complete the year. In Cameroon, fortunately, we were able to resume the class and to complete the year with students who were finishing or writing a certificate. But those who were not writing a certificate, the year just got finished there. So they will try to catch up during the second year. In some of the countries, they just lost the year. So they have to invest in education and think of various modes of education. I would end up by saying that in 2010, when I visited the Indira Gandhi National Open University, they were having 2.4 million students, which means that African countries too, if they really invest in various mode of learning, using TV, using online, using distance, they are able to improve the education and be prepared for the next pandemic, because they will not be the last pandemic. Thank you.
Thank you very much, Mama. I want to just go back, and I'm just looking at the audience. I can see a number of my NEF fellows that are also here. And if you would like to share your experience, I will allow 2 quick comments or questions if you so wish. Moisi, you will let me know if there is a question in the chat, or if there's somebody that would like to or if someone has raised a hand. Well, in the absence of that, I'm going to do a really quick summary of what we've discussed, and there are some important themes that have emerged from these discussions today. So first off, I think we've spoken about flexibility, and that is where Olivia has also told us a little bit about the interventions that are being made by benefactors, where there has to be some tailor-made solutions. And it's important that there's flexibility in the way that we are dealing with, in her case, different clients, but also flexibility in the way that we would be bringing in solutions for different countries, for different specific demographics. And we also looked at a challenge that is being faced by the informal sector. And Aurelia pointed out interventions that need to be made and are being made, specifically to support women and youth. And I really like the three-pronged approach that Aurelia spoke about: prepare, respond, and recover. I think we've got a lot of lessons that we've had during the current pandemic and previous pandemics in Africa, and it just gives us another level of preparedness. So if we can learn from these experiences and have policies in place, we'll be better prepared to face new challenges. I think the theme for me is really in the ICT space and the developments that needs to be made there in Africa to empower, as Mama just mentioned, education. And then on the same point is what Oliver mentioned, and that is modernizing the statistical data collection. And there again, we would rely a lot on having really good ICT infrastructure, reliable infrastructure. And a good point that Aurelia made was about diversifying the economy and really making use of initiatives that are already there on the African continent, and using that as a springboard to think of not just immediate solutions, but long-term solutions. So with that, our time is nearly to the end, but I would like you to please join me, audience, in thanking our panelists for their time and their insights today. Please would you join me in giving them a round of applause.
Thank you very much. Thank you very much.
Thank you so much. I apologize, I joined a little late, but it sounds like it was a great discussion that you've had for this evening. Thank you so much.
I also enjoyed very much, and I would like to thank you also, Sanuska, for being such a wonderful moderator, and also for summing up the major point that we all did this afternoon. Thank you again, and I hope to meet you all again in the next panel to discuss maybe post-recovery from COVID-19.
It sounds like a good plan. Thank you, Aurelia. Thank you to all our panelists, and I want to thank the audience as well for joining us. And we can now bring this to a close, but from my side, I also want to say that with these kinds of initiatives and hands across Africa that are working together, the future does look very hopeful. Bye.
Thank you very much. Bye-bye. Bye-bye. Bye-bye.